The Armenian American Health Professionals Organization of New York, New Jersey, and Connecticut recently held its recurring medical workshop hosted by the St. Thomas Armenian Church Cultural Committee. This continuing medical workshop has once again been organized by the program's chair, Kanari Khachadurian-Meyer, PhD, RDN, who also served as a mediator to the panel. With her introductory opening remarks, the panel participants started the event. Endocrinologist Dr. AAHPO spoke about treatment choices in diabetes. Dr. AAHPO is an endocrinologist in Piscataway, New Jersey, and is affiliated with multiple hospitals in the area, including Hackensack Meridian Health, JFK Medical Center, and Robert Wood Johnson University Hospital. In his lecture, Dr. AAHPO spoke about different types of diabetes and how badly this disease affects the organs. He also spoke about diabetic treatments and medications, and most importantly, how can the body react to a healthy diet and exercise.
The body is an amazingly efficient and smart engine that no matter what circumstances, in famine or feast, it can maintain a blood sugar at a very narrow channeling between, let's say, 85 and 120. And whenever something goes wrong, then those numbers start climbing past that 125, then you develop diabetes. And the long-term consequences of that would be damage to multiple organ systems. And the main ones that we routinely follow when you go every 3 months, we should go to, if you are a diabetic, to go and get your diabetes evaluated. The 4 main areas that we focus on is the vision, the kidneys, the heart, and the nerves. These are main ones that can cause serious problem. Kidney can lead to dialysis, which is one of the leading causes of kidney failure. Amputation of the leg when the circulation and the nerves are not functioning the way they should to protect our feet that take us places. And then blindness due to unexpected sudden hemorrhage from abnormal blood vessels that develop from high blood sugar. And cardiovascular. And or we say, oh, what is it? You go and get a stent, take Lipitor, and you'll be fine. No. But you could develop small vessels, especially the one that I fear more is in the brain, and you could end up with a stroke. And there isn't much there you can do. Okay. So how do we manage these diabetics? The foundation always is going back to diet and exercise. Okay, that is very important. You cannot say that, oh, let me have kunefa and syrup and all those cakes and ice cream and candy bars and donuts and pies and so on and so forth, and then I'll take my medicine and so on and so forth. No, I think you have to go back to avoiding refined sugars, avoiding refined flour, and eating more vegetables, grains, going back to the agricultural.
The next speaker was internal medicine specialist Dr. Tro Kalajian, a board-certified physician practicing internal and obesity medicine with a focus on diabetes, hypertension, and lipid management. His focus is on implementing lifestyle and dietary modifications whenever possible. Dr. Tro Kalajian himself has lost over 150 pounds and has worked with countless patients with weight loss, diabetes, and hypertension problems through remote consultations via telemedicine equipment and software. In his speech, Dr. Kalajian concentrated on modalities in weight loss and why.
So there's a little bit of confusion because there's a lot of opinions around nutrition. Should you do vegan? Should you do keto? Should you do low calorie? It's not clear. It's not clear. And everybody has their own agenda about diet, so it's not clear in the data when you're looking at diet, which diet should I do? And it's very confusing. And just this past week, hot off the press, maybe 2 weeks ago, they exonerated in Annals of Internal Medicine, they said meat is healthy. We were told for the last 50 years meat's not healthy. Now they're saying, well, wait a second, meat's not that bad. So what's going on here? And maybe some of this confusion, the fact that doctors don't know how to eat, maybe that's why we can't help our patients. There's 3,000 researchers. Is it the social factors? Is it the processed food? What's going on? Is it the cars, the air conditioning? They just don't know. And here's this confusing diagram from Obesity Week where they're trying to figure out what it is. They have no clue. And one week they say eggs are good, and the next week they say eggs are bad, and then the next week they say eggs are good again. You've probably heard it so many times, right? So they've switched back and forth, so it's very confusing, and I think they want you to be confused. So the reality is most doctors don't know, and the nutritionists don't know. We don't know enough about obesity. We don't know, and so we're having challenging times guiding our patients. Their cavities went away and their obesity went away when they limited the fruit. And the zookeeper said the fruit that is bred right now is too sugary. It's too sugary. So let's think about this. And are all fruits and vegetables created equal? Has anybody eaten a watermelon like this with the white? Has anybody eaten a watermelon like that? That's what a wild watermelon looks like, full of fiber. Look how small that strawberry is, the wild strawberry. And that's what it looks like in Costco, right? Has anybody seen a wild banana before like that, full of seeds? No, so maybe not all fruit is created equal. So we should rethink this fruit juices, fruit smoothies, and maybe we should rethink about this. Remove this sugar and fat combination. Pizza is the #1 most addictive food. The dough is carbohydrate, the cheese is the fat, and the sauce has the sugar. So it's basically 50% sugar, 50% fat. So the most potent addictive combination of food is pretty much sugar and fat. So no matter what diet you choose, if you limit these combinations, avoid foods that make you more hungry, basically the sugar and fat combination, lower your sugar and processed carbs as much as possible, like the good doctor said, stick to real food.
One of the other panelists was also Dr. Sylvie Khorenyan, MD, who is a practicing dermatology doctor in Park Avenue, New York City. Dr. Khorenyan works in Englewood Cliffs, New Jersey, and several other locations of Englewood Hospital Medical Center, Lenox Hill Hospital, and Mount Sinai Medical Center. In her speech, Dr. Khorenyan spoke about tips for healthy and beautiful skin and described causes of skin damage and infections, including manicure, pedicure, tatus, metallics inserted in the skin, and sunburns. She also spoke about the importance of protecting skin as the largest organ of the body.
So what are some functions of the skin? The skin is obviously a protective barrier. It protects us from trauma, from light, ultraviolet light, from germs and water loss. It regulates body temperature through sweat and flushing. It transmits, again, sensations of pain, touch, pressure, and temperature. It excretes sweat, and it's part of the immune response, first immune response to foreign bodies and infection. It secretes oil, which is very important in a healthy functioning barrier. And it's also involved in vitamin D production, essential for calcium absorption and healthy bones. Skin features, it's the largest organ. It has a lot of zip codes, so I cover the skin from head to toe, and the conditions and the features of skin really are different, whether you're looking at eyelid skin or the palmar skin. It includes hair and nails. So how do we improve our skin health? We protect it from sun, #1. Stop smoking. Smoking, actually, the first thing that happens when somebody stops smoking, their skin gets very healthy looking and almost gets a rosy glow. Nicotine is a major vasoconstrictor, and it makes your skin look yellow and ashy. Avoid excessive alcohol, which dehydrates you and does not make your skin look plump. Exercise is excellent because it increases perfusion to your skin. However, too much exercise outside in the sun can also do some real damage. You have to protect it from trauma, so if you do sports, you got to have the right gear to protect your skin folds nice and dry. Do not pick at your skin lesions. This is one way you could spread herpes and staph. If you have a sore, don't touch it, don't pick at it. You're likely to spread it. Do not walk barefoot in open, wet surfaces like near pools and gyms. Surefire way to acquire athlete's foot, which is a fungal infection, and plantar warts, which is an HPV, human papillomavirus infection. Keep your wounds clean. If you get a cut or a fissure, make sure you cover it with a little antibiotic ointment and a Band-Aid. Avoid overwashing and scrubbing and using harsh soap.
The last panelist of this medical workshop was specialist in orthodontics and dentofacial orthopedics, Dr. Robert Kinoyan, DMD. Dr. Kinoyan was recently selected by a vote of his peers for the 6th consecutive year to be included in the listings of top dentists. Top dentist TM listings cannot be purchased and is considered a singular honor. After his beloved wife's passing from an almost 10-year struggle with breast cancer, Dr. Kinoyan established the Marianne Kinoyan Memorial Scholarship Fund. Through the fund, Pramas Middle School and Elementary School and at the Hovnanian School is awarded scholarship monies for outstanding achievement in art and in music. Dr. Kinoyan is an active member of AAHPO. In his presentation, he reflected on a question of what is dental health.
So you're becoming a dentist. What's the secret? There's a secret, right, to keeping your teeth? And the secret is, brush and floss, floss, floss. Okay, if you can't floss, get something sweet. There are plenty of aids to help you floss. You should brush before you brush your teeth to loosen up all that stuff that's in your mouth. It takes plaque a couple of days to brush. So if you're brushing, it takes plaque a couple of days to grow on your teeth and irritate the gums. So if you're getting it cleaned out every day, you should have no problem.
This voluntary medical workshop is one of the many programs of AAHPO designed to aid and benefit to our compatriots here and in Armenia.